Okay, go ahead, Ben.
Okay, well, I'll probably start. So I'm Rahul Malhotra. As stated, I'm a private practice psychiatrist, and we just wanted to start with conflicts of interest. So, all of us make 100% of our income from our clinical work, and I'm a former member of the APA Assembly and NJPA board, but no longer, and I have no healthcare-related investments. Ben is an assistant professor of psychiatry at OHSU, no healthcare related investments. And Jen and Max are both PGY2s and have no healthcare related investments. Next slide, please. So I wanted to start the presentation actually by talking about, before we talk about climate change and what do we do about it, maybe we could just dispense with climate change denial and where does the term climate change come from? It actually comes from a political staffer named Frank Luntz in 2003, a communications expert who suggested that at the time, mostly right-wing politicians, but anybody who is discussing climate change should stop saying global warming. Instead move to climate change because the word climate makes us think of a nice climate like palm trees and change just happens. Next slide. So some other things about climate change denial. Before I tell you about that, I'll tell you all of the psychological, most of the psychological aspects of climate change that I talk about come from this great book, Emotional Resiliency in the Era of Climate Change, A Clinician's Guide by Leslie Davenport. Next slide. She talks about how there's elements of fight, flight, freeze. So, fight, paradoxical numbness, the idea that these things are happening, but we may not see them. So people get numb to the news. Tribal reactions, obviously, in the political climate, people tend towards whatever their tribe believes in. Flight, positive illusions, unrealistic optimism. Well, it's going to get better. It's going to get better. People are going to do things. The idea of greenwashing is the idea of saying, well, we'll sell you, carbon credits, and so therefore it's going to be okay, or this is a green product. Freeze, ambivalence, whose job is it? Somebody thinking about their immediate concerns over long term, what's going to happen. And finally, abstract data is hard to recognize. So, many of the readings are very dry, and, our talk at times might be dry. The reality of the situation might not be apparent until we're in it. So just to give you an idea of this, there was this nice book from the early aughts called Six Modern Plagues and How We Are Causing Them. Next slide. It had this epilogue. Thank you. It had this epilogue on SARS and beyond, and it was about the next coronavirus and what's going to happen. And it was quite dry, and it gave us no ideas to the reality we're living in. Next slide, which is. I like to take a look at, what are some of the local papers, and one of yours was the Nashua Telegraph, and you've got COVID-19 wedged in between news and sports. I mean, nobody could have imagined this in the early 2020 even, that this would just become part of our life. And I think so too with climate change. Next slide. There was this nice cartoon at the beginning of COVID-19. These people are in a boat. They're dealing with this big monster called COVID-19. Think how great you'll feel when this is over. And looming below is climate change. That's what it's going to be like. And if I could just ask anybody who's not speaking to please mute your microphone. Thank you. So if you want to see how this is going to shake down, you can watch pretty much any post-apocalyptic movie, which is scary, and we don't want to scare everybody, but that's sort of where we're headed. I just wanted to add, some of the most useful information that I've found about what can you as an individual do practically, which will also affect psychology, and is in this book, Pogue, How to Prepare for Climate Change. You can see these chapters: preparing for flood, preparing for heat waves, drought, etc. Next slide. Something that he talks about is just thinking about preparation. How do we prepare for this? The three steps are mitigation, trying to stop or slow climate change, which again we have to do on a systems level, adaptation, how are we going to cope as a society, and suffering. Don't say very much, but I added this. Something that I use frequently in my psychotherapy is the serenity prayer, which is to think about what is actually in our power to control and what do we not have the power to control? And what do we have to find the serenity to accept? And then reorienting ourselves. So that said, I really like this overall picture. This comes from a 2019 Hayes article. And here you have psychosocial health impacts of climate change and the way she's laid it out, influencing factors on the right, mental health literacy, communication and outreach, etc., which impact upon all these. But at the top, you have social determinants of health on the left, ecological determinants of health in the middle, hazards all impacting upon mental health outcomes, the things we treat on a day-to-day basis, and finally, the interventions, individually or as a society. Now, with respect to Hayes, I reoriented it. And I said, really, it follows mostly this, that the ecological determinants of health are in the lower left, climate change, ecotoxicity, and pollution, which then impact upon these hazards, extreme precipitation, extreme temperatures, wildfires, drought, sea level rise, climate change writ large, which is going to be how we're going to organize our talk, which then impacts upon social determinants of health. How are people employed? What is happening to their education? What is happening to their income? Which then tends to impact upon mental health outcomes. And then finally, there's the interventions. Now, everybody, if you just look at this for a moment and you think about your own individual patients, what are you treating? How is it going to be impacted upon by these social determinants? It helps you to understand why it's going to be important to think upstream from your patients and what's going to happen. And hopefully in the moments where you might get lost in the details in today's talk, think about your own patients and how are they going to be affected by the crises we talk about. Next slide, please. So that said, here are our learning objectives. Number one, mental health impacts of slow-moving disasters like drought, sea level rise, air pollution. Acute disasters, including wildfires, extreme heat, and floods. Extreme heat could be slow-moving or acute, but we lumped it in acute. And then finally, how do we increase resilience in vulnerable populations? Most of the talk is population-based. Most of us tend to deal with individuals, but it's important to think on both levels. So, you know, the slow-moving disasters span years to decades, the acute disasters days to weeks, extreme heat, sort of both. And then we'll talk about eco-anxiety and psychoterratic syndromes. Don't worry, we'll talk about that term later. So I think I'm turning it over to Ben for the slow-moving disasters.
Max, actually.
Yeah, I got it. So can y'all hear me okay?
So sorry, yes. Dr. Galvan.
That's okay. Y'all can hear me?
Yes.
Okay, perfect. So I'm going to start off with slow-moving disasters. So first, you notice I have this diagram. There's several different kinds of slow-moving disasters. I'm just going to focus on 3 for this presentation, just for time's sakes. You'll even notice if you have some keen eyes that one of the ones I mentioned isn't even actually included in this diagram. So it just gives you an idea that these aren't the only slow-moving disasters that are caused by climate change. Next. So first I wanted to focus on drought. I mentioned some effects of drought. Some of these are obvious, I feel like, and some of these are much less obvious. So the first 2 is food scarcity and loss of employment. So just as an example, here's the drought from 2011-2017 that caused a Central Valley Dust Bowl. So in the United States, it caused some issues with food production. Thankfully, the United States being a big developed country, it didn't cause any like true disasters in the United States, but it did lead to some people losing their jobs, you know, migrant workers, farmers. And in some cases, those people never recovered and they just had to find a different job. And in some other places, when this happens, what can happen is that those farmers end up just completely moving to a different, like a bigger urban area, to a different state, even to a different country. And then here's some more like less obvious effects. So like in Syria, so there's the Syrian civil war. We're not saying that drought led to that, but it did because of the tension, because of food scarcity is seen in the drought and the Syrian drought, we believe that that really exacerbated the sociopolitical crisis that was going on there. And the last one, I just kind of wanted to mention these two studies that were done in Australia and in India. They noticed that there was a correlation with drought, a positive correlation with drought and suicides. And even we all know that suicides can be a pretty complex thing. There's a lot of variables that can lead to that, but they looked at different states, different populations, and they all noticed a positive correlation with drought and suicides. The thing I do have to add is neither of these studies really mentioned that that climate change caused the drought and then the climate change led to the suicides. They kind of mentioned that climate change can cause droughts, but there is no like direct correlation that climate change led to positive correlation with suicide. So I just kind of wanted to mention that. The less obvious thing because of climate change is that nutritional values are changing in crops. Because of higher CO2 concentrations, the following nutrients have seen a decrease in certain staple crops, so iron, zinc, and protein. The crops that are specifically affected are ones called the C3 crops. I'm no botanist, but what I've understood what is going on is that C3 crops are crops that use a specific kind of photosynthetic pathway. And the botanists and the other experts don't really understand why, but for some reason, the increased CO2 concentrations lead to decreased nutritional value in these three important nutritions. And just to kind of give a review, you know, iron is critical for motor and cognitive development, zinc for immune system and pregnancy, protein is a building block in the entire body. I feel like I don't really have to go into too much detail of how important protein is. And just to kind of give an idea of the crops that are C3, it's like wheat and rice, which I feel like are pretty big staples in the United States and all over the world. So the next thing I'm going to talk about is sea level rise. So the IPCC in 2019 released a report that showed that sea level rise would likely rise between about 0.29 meters to 1.1 meters by the end of the century. That same report kind of noted some other, like they mentioned different possibilities, you know, some that are less dire, so less sea level rise, some that are more dire. There's another study that kind of focused on a little bit more dire one of 1.8 meters. And in this study, what they noticed is that if in the United States, our sea level rose by 1.8 meters, the places that would be most affected are the southern East United States, so like Florida, Georgia, South Carolina. And this is a really big deal because what's going on right now is that the population boom is more in the South and the Southern East states. And unfortunately, those are the ones that are most susceptible to sea level rises. If you just look at this map, you can see it's really colorful around Florida. That's the one that is most affected here right now. And unfortunately, this is also the areas that tend to have lower socioeconomic status people and people of color as well. And I just kind of wanted to mention one example here, the Isle de John Charles. This, just to give kind of an historic aspect, back in the 1830s, because of the Indian Exclusion Act, the United States government pushed some Native Americans to live on this island that's a little bit off Louisiana. And because of climate change, there's been erosion and sea level rise, and the island's been getting smaller and smaller to the point it's pretty much almost uninhabitable. There used to be about 300 families living there, and now there's only 26 families because the government of Louisiana has been working to help these people move. The problem is that those families that are staying behind, they don't want to move because now they don't want to lose their homeland and their culture. And I feel like that's another thing that we don't think about with relocation is that we're going to be losing some really historic places. I always kind of think about New Orleans, a place that has a lot of history and a lot of beautiful culture there. And it's one of those places that's very susceptible to the hurricanes. And I'm always worried that in my lifetime, there's going to be a hurricane that's going to be so big, it's just going to wipe out that whole city and we're just going to lose out on New Orleans. And that brings a lot of feelings in me. Next slide. And of course, the people that are most affected are other people in underdeveloped countries. So there's the Vietnam Mekong Delta, which will face some major changes in food production and ability to live in low-lying areas because of those sea level rises. The other country that I just kind of wanted to note was Bangladesh. So Bangladesh only experiences 1% of all the cyclones, but they still get 50% of all the cyclone deaths because they don't have the capacity to prepare as well as we do. One third of the country is also vulnerable to flooding. So because of sea level rise, their country is very susceptible to flooding. And the other thing they really got to worry about is because of the sea level rises, there's food insecurity and lack of water access, because that salt water that seeps into the crops and seeps into their freshwater sources is really bad for that. And because of all that standing water, there's increased rates of diseases such as like the rotavirus. And the thing I hadn't even talked about, but that was mentioned in this study that brought up all this information, is a psychosocial impact. They kind of stick to like PTSD in this one, where families that were affected by floods, where they lost their homes or they lost a loved one, and they're just really anxious about what happened before, and they're just really anxious that it's going to happen again. And because of that, it just kind of gives you the idea that even though they survived, they're never going to be the same because of that accident that was caused by climate change. The last thing I want to focus on is air pollution. Personally, when I was researching on this is the one that really surprised me of all the three I was looking at. So this study said that air pollution leads to a loss of 2.2 average life expectancy loss per person. And just to give an idea of how significant that is, smoking, I feel like we all know how bad smoking is. It's only 1.9 years in comparison to air pollution. Alcohol and drug use, HIV and AIDS, malaria. And you'll notice that some of these are dwarfed by like how bad air pollution is. And I feel like some people tend to focus only in like, the lungs, the damage of the lungs in air pollution, but it's also really toxic to the central nervous system. Next. This paper particularly just talks about how many more deaths were caused solely because of fossil fuel combustion. So in other words, they looked at some models and essentially they ran the models to see how many people would die without any man-made air pollution, and then they ran the same models but with those man-made air pollution. They noticed about 8 more million people died in the world because of the air pollution caused by man-made fossil fuel combustion. Next slide. And this just maps just kind of like exemplifying the areas that are getting affected. You'll notice that it's mostly East China and India that's most affected by air pollution. Next. And now I'm just going to pass it off.
Okay, and that was 8 million deaths, premature deaths per year. They were looking in that sample in, I think, 2018 in that 2021 study on air pollution. So thank you for the slow moving disasters. That was a heftier section than what I have here for acute disasters. And namely, we'll focus on wildfires and severe storms. So the hurricanes and the floods. And so, I mean, it's pretty intuitive kind of to expect that you're going to have the immediate distress responses, the anxiety, the health risk behaviors of substance use. And then the PTSD can be sometimes even, can be delayed. Sometimes you don't pick up on it until 6 months or 12 months down the road. But if we first start with wildfires, then the map on the left speaks to how, well, the range and intensity, well, it doesn't quite capture everything, but so the range of wildfires is clearly expanding to places that we've never had wildfires before, like Siberia or Alaska. The intensity of fires is just clearly much higher in the past few decades. And then the duration of wildfire season is much longer, with states like California being basically, feels like almost year round, almost there's a risk for wildfires. And then, especially when we're in a state of drought. And then when you look at an example like the Paradise Fire in 2018, the displacement in its community was just incredible. It was thousands, tens of thousands population previously, and then went down to like the hundreds. And so completely just upends communities. And also it's not just the communities themselves, but even the wildfire generated from the wildfire events, such as the Paradise Fire, led to 6 of the 10 worst days ever for PM 2.5. And you look at 2 straight weeks, I think that has a toll on people's mental health, even on the short term. But when it's an annual event, it becomes kind of frightening. I'm in Portland, Oregon, and last year we had the wildfires, and like there was nowhere you could even escape to, even if you were a little more affluent and able to drive away. You couldn't even drive into Bend or the mountains or anywhere. It was just, we were completely covered on the West Coast. So the health effects are important to note. And the immediate risks of like ischemic stroke go up like by about 24 to 48 hours, even just for a 1 standard deviation increase in the PM 2.5, you're at, I think, an odds ratio of like 1.4 risk of an ischemic stroke, which is not significant air pollution. It's just that's just a little bit increased over the average. And we get way higher increases in wildfires. So here is here's the Western States Pediatric Environmental Health Unit in housed at UCSF, associated with UCSF, and they just published a chapter on how to teach the public and honestly ourselves as providers on how to handle bad air quality, how to prepare communities and clinics, and for people to prepare their own indoor air spaces. So for in the events of wildfires. And so here's a even more specific graphic on the actual reductions that you will be able to achieve if you say, like if the decrease in 30% of your exposure to the wildfire smoke, if you just go inside and shut the windows, whereas maybe you could go into your car, and if you can recirculate air-conditioned air, then that's a pretty substantial decrease in the risk of the in your exposure to the wildfire smoke, as well as properly wearing an N95 or even wearing a medical mask to a lesser reduction, but 20% better than nothing. And then in the wake of like events like wildfires, just recognizing that access to healthcare becomes cut off. And so this is one of the influencing factors from that table of 11 influencing factors that Rahul pointed out with that Katie Hayes study. So physical access, not just financial, but also physical access, which becomes problematic for everyone, for the people, the end users, for the recipients of the care, and for the healthcare delivery people when we also can't get to the facilities and get to the places that we need to go due to personal injury or roads being closed. I think today in Canada, there's a community where they cannot evacuate to the biggest neighboring city of Vancouver. They're having mudslides there. And this was a place that was actually shocked at having some pretty severe wildfires earlier in the summer. I can't remember which city that was, but to think of these double disasters of wildfires in the warmer months and then now mudslides during these stormy months and the risk of flood. They are flooding right now. Like that's pretty frightening. And we have to attend to as a healthcare system, we have to think about that. And then also a healthcare delivery system, we have to think about that. So, so severe storms then, just like wildfires, the range and intensity, particularly the intensity is really increasing. And whereas we see recent hurricanes coming from the Gulf and getting all the way up to New York and leading to deaths of people in their basements, especially vulnerable populations where they have nowhere else to go. That's a very preventable tragedy and also very surprising. Sometimes we can't respond fast enough to these acute disasters. And just like in Canada today, in that flooding mudslide risk region, I think they only had like a few days notice to get out of there. And now they can't. Quite, the roads are shut off. So Hurricane Katrina is an example, our most devastating disaster in terms of lives and environmental disaster in terms of lives and money. Super, super costly. Devastated 80% of the city of New Orleans and also led to a collapse of our healthcare delivery system. If you look at like their biggest public sector hospital, Charity Hospital, that accounted for about half of the city's public sector beds. There were 200 plus beds and Charity accounted for about 100 of these. And they did not reopen even as recently as 2020 and presumably I think 2021 as well. But that has yet to come back. And so these are so certainly in the wake of the disaster, that was a big issue as even more. Whereas like the severe mental illness rates went up from about 6% to 12%. And the any mental illness also doubled from about 15% to 30%. I guess the story is that mental health disorders increased they doubled immediately pre and post Hurricane Katrina. And then just to think of our healthcare system, which is already so precarious, especially the mental health system, then there was a severe increase in need and a severe reduction in what we could provide for people. And then this is just an image about like the displacement that you also see, just as you see the displacement as a very common theme of the droughts and the sea level rise. And maybe perhaps we are maybe a little too delayed in our getting people out of these risky places in our own country in Florida. But in the wake of acute disasters, there's devastating displacement. And many of these folks, if they can make it back to if they're fortunate enough to find another house where they go, like they might still face another, like there was a significant number of people that went to Houston and they suffered another disaster. So a disaster on disaster, a trauma on a trauma. And the vulnerable populations tend to live in the more places that are damaged with greater severity, with less infrastructure and support. And so they have a farther delay to returning to their homes too, if they can even return to their homes. So thinking about mental health literacy, thinking about Hurricane Katrina, mental health literacy, as defined here, the knowledge and beliefs about mental disorders, which aid in their recognition, management, or prevention. The mental health literacy was a big issue during Hurricane Katrina. And so the stigma of mental illness led to people not so much oftentimes being closed off and not wanting to seek care. And then first aid responders and physicians at the same time lacking the training to deal with psychosocial and psychological trauma. And so when we teach people psychological first aid, that is also helping them learn how to deal with mental health literacy, to mitigate issues with mental health literacy. And so government assistance rather, we can think of it post-disaster and we can think of it in between disasters. And so just to kind of piggyback off of what Max was saying about the tribe over in just south of New Orleans. So that is actually the first community in America to receive federal funding for a inland retreat to relocate this community that has already had landmass decrease by 98%, according to the tribal council there. And so they have funding, but it still is problematic when you're relocating a whole community. So I'm going to pass it on over to Dr. Darnell to talk about extreme heat effects.
All right, thanks, Ben. Yeah, next slide, please. Yeah, good. So I'm going to start. Oh, sorry, can you go back one? There, thanks. So I moved from Redlands, California this past July, actually mid-June, back to Portland, Oregon. I'm originally from the Pacific Northwest. When I left, it was about 90 degrees in Redlands, California, which was pretty much the norm for several weeks there. 2 days later, when my family arrived in Portland, it had a recorded high of 116 degrees that day. We moved into a 4th-story apartment in a building that was built in 1911, so there was no AC. It was very brutal. I had to take several towels, drench them in cold water. I threw them on my dog, and just from overheating as we were just unloading stuff from the car into the apartment. And the temp in our apartment at that time was maybe 92, 93. And, luckily I was able to seek refuge with my parents for a few days, but that was kind of my first rude awakening into returning back home and into kind of experiencing extreme heat like that, even after having lived in Southern California for 2 years. Just as kind of some facts here is, per the US Census Bureau in 2015, about 30% of homes in Portland, Oregon don't have AC. And I don't think that probably has changed over the past 5 or 6 years. That's over 271,000 households without AC, and that's including a window unit. And during that week, Washington State officially reported 95 deaths and Oregon similarly 96, but we suspect this is very severely underreported. Next slide. So this is from the CDC, just showing a huge spike in deaths during the week of the heat waves in Washington and Oregon, over 400 in Washington and over 100 in Oregon. So being from the Pacific Northwest and having experienced like all of these, beautiful summers here, this is pretty devastating, I think, on a personal level. Next slide. A big question with climate change and the rise in temperature is, can we acclimate to this higher heat? The body radiates heat, and if the environment is better, our heart pumps harder. When it's humid, sweat doesn't evaporate from the skin due to saturation with water vapor. And we do rely on nighttime temperatures, but these nighttime temperatures are now rising, so not really giving us a chance to cool off. With heat acclimation, we're looking at, 2 to 6 weeks over 2 hours of exercise in the heat. It's still limited and obviously not possible when we experience abrupt, drastic changes in heat like we did with the Pacific Northwest heat wave. And it's also associated with poor air quality, reduced food and water quality, changes in infectious agents, and population displacement that Max and Ben had talked about. And this leads to many adverse health effects, heat-related illness, cardiopulmonary stress, and mental health issues as well. And other factors that play into this are social and behavioral constructs, age, gender, race, access to care, socioeconomic status, and then the environmental constructs, agricultural, geography, infrastructure, and ecosystem. Next. So when we address the specific aspects of extreme heat on mental health, we're looking at the whole gamut where we see adverse effects, suicide, violence, exacerbations of psychotic disorders, dementia, cognitive function, and insomnia. Next. So this graphic is from Nature Climate Change. It just shows a linear relationship between increased temperature and suicide rates in the US and Mexico, respectively. Looking at this also projects an increase of 21,000 additional suicides by 2050 due to climate change, and wipes out gains due to suicide prevention programs and gun control. Next. I think most of us all feel pretty irritable when temperatures get hot. I think we also see an increase in violent crimes. This graphic just shows an increased rise in violent crimes over the warmer months over the year in Ohio. Other scientific evidence has substantiated this general understanding, showing that one standard deviation increase in temperature contributes to a 4% increase in interpersonal violence, with particular concern for domestic violence and abuse of women and children, and a 14% increase in intergroup violence. Next. We can have exacerbations of underlying psychiatric illness. There's a systematic review on 35 studies looking at broad mental health categories in climate change, and the strongest evidence out there exists for increased suicide risk in high temperatures, and also an increase in mental health related admissions and ED visits as well. Next. Here we see this gentleman pretty much saying he can't think, can't function since it is too hot outside. And I think we've also all experienced that as well. But there is evidence as well that supports impairments and a wide range of cognitive functions. It's associated with reduced attention and reaction times that has implications for work performance, productivity, and worker safety, as well as effect on complex cognitive tasks such as working memory, pattern recognition, spatial span, and the elderly are particularly impacted with executive functioning as well. Next, yeah. With regards to nighttime cooler temperatures now heating up, we have an increase in insomnia and poor quality of sleep, which also impacts our mental health and cognition. In 2015, the CDC declared sleep orders a public health epidemic, and that definitely plays into climate change as well. Higher temperatures are associated with increased severity of obstructive sleep apnea, and a 1% deviation in monthly nighttime temperatures can be associated with an increase of 3 nights of insufficient sleep per 100 people. And when we stratified these analyses, the negative effect of higher temperatures is stronger among elderly and lower income people. Some things that we can do to try and keep cool during the nighttime when the temps are high is, sleeping low, dampening your sheets, making sure your ceiling fan is going in the right direction. I only learned this a couple years ago, actually. But you want your fan going counterclockwise for cooling in the summertime to circulate the cool air, and then clockwise in the wintertime to circulate the warm air. Next. Psychiatric medications are a particular concern as they potentially interfere with the body's normal heat and fluid regulatory mechanisms. Antipsychotics, some antidepressants, and antiparkinsonian drugs interfere with heat regulation and sweating. And photosensitivity can be a side effect of antipsychotics and other medications. So you can have risk of severe sunburn and heat stroke. Lithium levels can rise with excess fluid loss through sweating and dehydration, risking dangerous or toxic blood levels. And then signs of heat exhaustion and lithium toxicity can go unnoticed or unrecognized by patients. And when it's hotter too, your heart pumps faster, increase in heart rate, and beta blockers can also mute that effect. Also, drugs are guaranteed effective at mild temperatures. So when we have patients, who don't have air conditioning at home, storing their medications, that can also affect the efficacy. So with extreme heat, we want to know who is most at risk of experiencing these adverse effects. Next. We have people who live alone without AC. And this also mentions cities and urban areas where they can be urban heat islands. And an urban heat island is like an urban or metropolitan area that's significantly warmer than the surrounding rural areas, contributing to higher temperatures. This is contributed by a number of different effects. So there can be AC that pushes hot air out, hard, dry surfaces, such as, a lot of concrete, big parking lots, where there's just less shade and moisture than its rural counterparts. So people who have certain health conditions, heart disease, mental illness, people who are under the influence of alcohol and drugs, and then homeless population. So the homeless population has a very high chronic disease severity index versus those who are housed, and 91% of homeless population live in urban areas and are very vulnerable to the heat island effect as well. And then people who work outside. Being in California, this was a huge topic when I was down there. CDC found that farm workers die from heat stroke at a rate 20 times greater than any other non-military worker in the US. And currently there are no federal standards that require employers to provide water, shade, or rest while working in extreme heat. In California, they're required to provide 10-minute shaded rest breaks every 2 hours when temps are over 35 degrees Celsius, which is 95 degrees Fahrenheit. So very high, and access to cool water, but again, not quite mandated. And then people who work inside without air conditioning. This is a 1 million square foot warehouse facility for Rite Aid in California. And the only AC room is for keeping the chocolate cool. It is not for the employees.
Oh yeah, I thought it was closed.
Oh, it may have been closed. But there is a big warehouse growth in some of these hot cities. It's ramping up, and they do rely mainly on fans for cooling and not AC. Incarcerated population. So this was a pretty great podcast episode. Also very scary. It's Into America, called Locked in Hell. And it talks about Texas, which is one of the hottest states in the country, and the prison system. So Texas is not required to provide AC for the prisoners or in their prison systems. They talk about prisoners throwing garbage outside their windows because they don't have garbage cans and it stinks. And so they end up blocking off the windows, which is their only source of outside air. And when that happens in the summertime, it traps the hot air inside. And so inside can get up to 20 degrees hotter than outside. And the heat indexes have been reported as high as 150 degrees. And there have been measures to try and require the Texas system to install AC. However, more money has been spent on blocking these measures than it would have cost to just put AC in all the prison system. Next, yeah. When we look at infants and young children, we think of ACEs. Natural disasters and extreme heat can be related with loss of basic needs, loss of family members, anxiety, PTSD. And then the elderly bear a larger proportion of disabilities, chronic medical conditions, social isolation, which all contribute to this increased vulnerability. Next. This is just a case thing from the Lancet. It's like a case profile looking at different health risks, vulnerability, strength, health outcome, and adaptation actions. I really liked reading through this because it actually talks about like possible solutions to some of these cases we see with vulnerable populations. Next. So this is Sasha. She's just, she's a Black young female. She has asthma and she's having an asthma attack from air pollution that's being exacerbated by heat. You know, she has insurance, it's not great. She's middle class, she has good family support, otherwise healthy. Next. So she goes to the ED, she gets treated for an asthma attack. And something that we can do on like a healthcare level is maybe working towards real-time air quality surveillance programs that sends warnings out to vulnerable populations when the pollution levels are high. This is just a small map that shows the world's hottest places and region by continent. We have Death Valley, California, and just reading about Death Valley, it's very interesting. There are 300 to 400 people who live there year round. The average temps in August are 110 to 125. It is dry heat, so we're able to, not we, I have never been there, but the people there are able to sweat. And I was reading a little article about them, it's just on Business Insider, but took one resident about a year to acclimate to the heat. And people, you know, they run outside when it's like 119 degrees. If it's in the 80s, someone will wear a sweater. And there are about like 150 very eager national park rangers who, you know, have their own community out there as well. Everyone in that area is essentially on their own in the summertime, since no one wants to go to Death Valley, California. And they're able to, you know, function as a community. They rely very heavily on each other. They've adapted, you know, well to the heat. Some things that they do is, you know, always bringing a backup satellite phone with them, frequent car inspections to make sure their car is working in case they get like a flat in the desert where they might not have reception, and then always making sure there's water in the car wherever they go. Just kind of something to show that, you know, maybe some of the realities that we may face in some of these regions that are getting hotter. And the CPA has made downloadable kits to use as brochures for office and clinic waiting rooms, provides a lot of educational material for mental health providers about heat impacts, particularly for our psychiatric populations. And there's guidelines and tips for patients and families as well during extreme heat. All right, I think Rahul is going to take over now.
Yes, you know, I just wanted to start with this term psychoterratic and somaterratic. Comes from Glenn Albrecht in 2007, the idea that terra is earth-related. And so he said psychoterratic is the earth's impact on the mind. I was, when I read this, thinking, well, we say psychosomatic means, you know, the psyche's impact on the soma. There's also the term somatopsychic, the soma, the body's impact on the mind. So I personally would have gone with terra psychic, but I wasn't consulted, and nor should I have been in 2007. That said, what is a psychoterratic syndrome? Eco-anxiety, climate fear, climate grief. There's a lot of overlap here: isolation, denial, trauma, and then at the bottom there's this term solastalgia. And what is solastalgia? Next slide. It's existential distress, also from Albrecht, existential distress from environmental degradation occurring in one's familiar home landscape. So homesickness while you're still at home. And it comes from the combination of the Latin word solatium for comfort and Greek word algia for pain. And we're going to be thinking more about this as time goes by. Just, as an idea, there is a measure of climate change anxiety. If you were to take time to read about it, you'd find single words like number 1 is concentration, number 2 is sleep, number 3 is nightmares. But it could potentially be a tool. Next slide. So the book that I used was Davenport. I actually, after Reb McKenzie asked about Bob Dopelt, this is the miracle of the modern world, right? I bought Bob Dopelt's book on transformational resilience and just skimmed through it, looked at the table of contents. This is really good stuff in there, which I will be going through, but I had not read it previously. So I had turned to this emotional resiliency book by Davenport. Similar themes, though. I mean, basically, clinical themes are, thinking about, she generalizes it to mental health clinicians, but we're psychiatrists as leaders, and the idea that we can help people understand the ideas of all life being connected, standing for sustainability, assisting deep self-inquiry to figure out the story, develop the narrative, compassion fatigue, idea of, we will be looking in ourselves and also helping others who get tired of helping. Survivor guilt. People are it's going to be bad. And some people are going to survive more strongly and others aren't. And those people will have guilt. Recovery fatigue, the act of actually recovering and what happens to people. Helping people with self-care. Sorry, can you go back to the previous slide just for a sec? Self-care, loving kindness, which is actually another theme out of the Dopelt book, and resiliency. And loving kindness, I'm personally looking into more and more. We don't really talk about it in psych residency. It's not what we do, but the idea of treating oneself the way one would treat others is going to be really important. Next slide. Something that I'm thinking about, and I haven't fleshed out this further because I'm really thinking about what is meaning when there's no future. I highly recommend reading Man's Search for Meaning by Viktor Frankl. If you have not, Viktor Frankl survives the concentration camp by thinking about the future. And when there isn't, hopefully there'll be a future, but if the future is going to be very different, then how will people find their meaning? And we will have to work with individuals on that. Next slide. She talks about grief, pain, and resiliency, thinking about the Kubler-Ross stages, which we all know well. Pain, thinking about empathy versus compassion, helping people, not just understanding, but helping and being kind. And then finally, encouraging resiliency, which is a word we throw around a lot, but it's a hard thing to build. So I am learning more. Dopelt's book looks like it's going to be good, but here are some ideas that Davenport has, encouraging, fostering trust, kind curiosity, being aware of one's own body. Dopelt also talks about that, knowing one's own story, expressing oneself creatively, and then finally evolutionary transformation. Who do you become? How do you change? And, an important theme here is next slide. So Luntz, who created the term climate change in 2019, declared that he was wrong. He has transformed himself, and he's encouraging people in all political parties to figure out what language to use to encourage change and also to focus on positive, which is very much one of those clinical themes. Next slide. And I'm just going to turn it back to Ben to wrap us up.
Yeah, I'm taking a look at the chat so far, but honestly, we should open this up to the questions. I know Dr. Fader maybe was going to facilitate a little bit, and I know our time is short, but here on this slide, well, before getting to the slide, just with Bob Dopelt's transformational resilience, that is absolutely a wonderful tool. Oh, and it happens to be what I listed right there, their logo for the C in this Care to mnemonic on how we can engage. This mnemonic is from a paper by Dr. John Coverdale from Texas, and ways for healthcare providers and the healthcare system to engage. But yeah, transformational resilience, absolutely. It's they focus on not just the presencing skills, the grounding and the observation, the self-awareness, but also the purposing skills. So not just the presencing, but also the purposing, because in order to lead a vital, meaningful life, you really do need to, I guess, engage with your community and be inspired and have faith that others are taking action, that trans-sectorally, there is a lot of attention towards climate change. And certainly climate change and health is a huge issue. So yeah, with this mnemonic, I guess we can probably just leave it up to, we can end pretty much with the PowerPoint here, and just to go through clinically, just getting our healthcare providers prepared for the needs that are coming, certainly in health and mental health issues. Administratively, that's disaster preparedness and response, but also a gigantic part is greening the healthcare systems. When the US healthcare system is responsible for about 10% of our country's CO2 footprint, compared to globally, it's more like 4.4% of healthcare globally is 4.4% of the CO2 footprint. So we have clearly we have improvement that's possible in our healthcare system, in our footprint. But greening our hospitals, our clinics, our research facilities, advocacy. Well, I guess there's not much to speak about that, but I imagine your organizations are doing plenty of advocacy, and so research and education. Finally, educating at all levels: undergraduate, graduate, postgraduate, and in our residencies. So the Medical Society Consortium, the MSCCH, Consortium on Climate and Health, is a group of not just health profession schools, but also public health schools, and getting a set of curricula that we really can broadcast more universally. So I'll stop screen sharing there. And then, well, maybe there's one more slide actually, if I can get there. But, oh, well, let's just stop the screen share then.